Jim Millaway, whom you heard from earlier, is a partner at the Holmes Organization, which is a brokerage and consulting firm in Tulsa. And someone who's not on the program, but Jim will introduce a doctor because he'll do a better job introducing than I will. And we'll get the microphone set. We'll hear from these two, and then we'll have a break before the home stretch of the conference.
Hey, thank you. I appreciate it. I want you guys to meet my colleague, Dr. Stan Schwartz. Dr. Schwartz is an internal medicine physician with a subspecialty in infectious disease, 28 years in private practice, and for the past 10 years was medical director of Warren Clinic and a VP at St. Francis Health System and involved in population health and epidemiology and things like that. And he retired from that post effective December 31st of 2013. And after about 2 weeks, I was able to convince him of how bad an idea that was. And so he was retired for 2.5 weeks, but I'll tell you, it was long enough that he had at least one day where he didn't know if it was Thursday or Friday. So I'll let Dr. Schwartz take the mic now.
Okay. Well, the situation is that my toaster broke, and I need to order a new one. So I'm just going to do what all folks do when they need to order. We're just going to go on the new iPhone 6. You really like it, by the way. And we're just going to go to Amazon, and we're going to order us a toaster. So let's put in toaster up here. Toaster. Okay, toaster in sports. I'm not going to use a toaster in sports and outdoor. I'll probably use it in the home and kitchen. Okie doke, there we go. There's a bestseller there for a 2-slice toaster. It's $24.44. I hope you can see this in the back. Wait a minute, I'm from New York. I need a toaster that takes bagels. So let's put in bagel. We got to be more specific here. There we go. Toaster bagel in home and kitchen. Looks perfect. Hey, there's one. Oh, that one looks really good right there. So let me go ahead and I'm going to order this one here. I'll go ahead and I'll put it in my cart. Okay. Now you're going to have to trust me at this point that I'm actually going to buy it with the next, because my wife is tired of all these toasters coming to the house. So here, I'm going to add it, and you're going to have to go, okay. Okay, so I've ordered the toaster, and wait a minute, I hear noise outside. It's the Amazon drone carrying the box. Here it is. Got my toaster. I am so excited about this. I'm going to open up my toaster. Oh, God. Hurt my arm. It's that rotator cuff again. Look at this. Look at this. Oh. The rotator cuff. I can't even type. Send a text message to James Millaway saying, please arrange the rotator cuff surgery for me. Okay, good. Ooh.
All right. We'll go ahead and hook my phone up now, and I want to show you where we're going to go with this. Okay, so kind of our little vignette with that brings up one question. So I think there's really probably 3 or 4 inventions in all of the world that changed my life. So I'd say electricity, concrete, refrigeration, and can anyone guess the 4th? Amazon. So, while Stan really isn't ordering tons of toasters, my wife gets pretty upset with me because I buy everything on Amazon, and it's almost sacrilege because I've almost made Target irrelevant, and she loves Target. But, you know, Amazon's easy, and it does some wonderful things for me that make it simple and make it where I can trust it. It gives me instant gratification. If I know I need something, Amazon shows me how to find it, and they show me how to find it quick. But it also gives me cognitive control. In a sense, when I buy something from Amazon, I have a clear idea of the roadmap from start to finish. They send me a receipt. They send me an email with a tracking number. I don't ever track it, but it's there, and I know if I needed to know that it was still sitting in the loading dock at Dallas, Texas, it can do that for me. I think that healthcare needs to act the same way. So we've got wonderful providers in this room that are transparent. And we've got good TPAs that help facilitate that process. Where Dr. Schwartz and I want to change it is I think it should be as easy as Amazon for the end user. It has to be that simple. Now, believe it or not, Dr. Schwartz will never believe me, but I actually took notes because there was a couple points I wanted to make sure that I made. And, everybody's got a smartphone now. 58% I think of the U.S. population is on a smartphone now. So even Adam Russo's truckers on methamphetamines have Android phones. And in that population, that phone is their only mechanism for getting on the internet. That's their computer. If we wanted it to feel like Amazon, we knew we had to replicate what Amazon did. So, one of the beautiful things about Amazon is Amazon subscriptions. Is anyone on Amazon subscriptions? Yeah. So every month on the 7th, the one thing that always comes to my house is boogie wipes. I have a 3-year-old and a 3-month-old, and these are like the best things ever. I can't live without them, and when I need them, they're the easiest thing to ever get. Does anyone have an Amazon phone on their app, or the app on their phone? Someone that does, open it up. And then, don't do anything else yet. And we're going to demo our app for you guys, and it's not quite done because the IT guys never really get everything all the way done when we need it. But you'll get a good idea of it. Okay, so Jay, you got Amazon up? Okay. I'm going to open the app for the Zero card. Okay. Stan needs a rotator cuff surgery. Jay Kempton needs boogie wipes. So on the count of 3, is Amazon quicker than healthcare? Let's go.
I got it. 1786.
So we tied. I'm going to go back and go slow. Yeah. So you guys can see how this works and what simplicity means. So this is the application. The idea is an employee, a family member, or someone sits in their doctor's office, and that doc says, you need X procedure. We need to answer the question of where do I go before that person walks out of the exam room. You can come back and forth and scroll from the front back to the head or other services. And this will have dots on it, just what you guys are used to, but right now you can search by category. All I did was go through here, find a shoulder, tell it was rotator cuff, and that's competition. I mean, those are all transparent providers, all willing to compete. Now, the one thing that the IT guys left out that you guys are probably saying is, this is a weird transparency app since there's no transparent prices on it. So they haven't put the prices in it. So I'll tell you what the prices look like. I got a screenshot of it. This is what it'll really look like. So instead of just those listed like that, you'll actually get to see the name of the procedure, the pricing, and all that. And it's always zero for the employees. To talk about skin in the game, we knew we had to make it zero. And originally we didn't make it zero as an incentive for employees. We needed to make it zero because it wasn't cash to Keith Smith if he had to chase a copay or a deductible. I'm obsessed. I mean, I love Amazon because it's effortless. I love Uber because it's effortless. Now I have a new app called Acorns that I don't know if anyone's familiar with, and it's effortless. Acorns actually looks at every transaction in my checking account, and it rounds it up. And every time they round it up, they take that money and put it in a Vanguard account. So I'm investing anywhere from $6 to $20 a day without ever feeling it. Healthcare needs to be the same way. Dr. Schwartz and I have one monumental task that we have to do, is we have to put healthcare at everybody's fingertips and make it effortless. And we think that's what that app's going to do. And so we're anticipating the apps were supposed to be done for today, but certainly in the next few weeks, the iPhone and Android apps are going to be out there. And this isn't just for our employer clients. You don't need a password to see this. The whole world can get this app and use it as a price comparison. And the Zero Card's the program we built. It's called the Zero Card because nobody has to explain it. I don't have to explain to my wife what the Zero Card is because everybody gets zero. As long as you choose what your health plan thinks is a high-value provider, you're never going to pay a buck, and all we try to do is make it easy for you. So that's the app. We're really excited about it. I think it's really going to change the way people shop when it's just that easy to find out where to go. We're not a transparency tool because we don't need we don't need tools because all our providers on it are transparent. We're not a network. People still say, this is a network, but it's not. It's the non-network. And, we've got great partners, certainly in Keith, and then the Kempton Group, who's our administrator behind the Zero Card. And, we're excited about what it does, and we think I really honestly believe when we make it easy for people to shop, it's going to change everything. So certainly thanks for letting us take the time to show you guys that. And if you have any questions for myself or Dr. Schwartz, fire away. Yeah.
It's so cool. It's not a question. So I looked at like Health and Reach, and there's one in Snap Health in Texas, and sort of medical marketplaces. And I was wondering, what makes you different, other than it's a mobile app, and then also, does the client pay the facility, or do you take the money and send it to the facility?
Okay, I'll answer the money question first because it's the easiest.
Okay.
So the money works just like any arrangement would with a TPA and Dr. Smith, and so those, effectively bills are coming to the Kempton Group, who's the administrator behind this, and then those are being paid direct to the provider by the employer, on behalf of the employer by Kempton. And so just like a normal TPA arrangement would work. I'm not familiar with those other applications. Everybody else that we've seen, we don't think this is a product for providers, and we don't think it's a product for purchasers. Really deep down in my heart, I think this is a product for patients, and we're so focused on what that means for them. Right now, this is a directory. It's a transparent directory to say, here's where you can go for fair prices, But that's just the first phase of the app. So we're talking with software as service companies and other potential partnerships. The next version of this app isn't just going to show you where you can get an MRI. It's going to show you who can do it at 2 o'clock today, and it's going to let you book it in there. And when you book it, you're going to get your voucher on your iPhone app, and when you leave, the hospital is going to say within the app, send the billing statement. If Uber can find me someone to pick me up and handle all the transactions, then we should be able to do the same thing in healthcare.
It should be an app for primary care providers, though. Because often I'm the advocate in the room with the patient who needs the procedure, and I say, have you even heard of this?
Yeah. So that brings up a great point.
So, I don't sell MRIs, but I help them find MRIs. And especially in the direct-to-care model where I advertise to my patients, it's my job to help you find cost-effective services. That's what makes my membership worthwhile to you financially.
Yeah.
I could talk for hours about how it's worthwhile just with respect to access and care. But
yeah. No, absolutely, I agree.
This is something that is absolutely going to be part of my armamentarium.
Yeah, and it doesn't cost anything. You can do it. What will become over time is just the largest directory of fair price, cash price providers. But that's a good point in primary care. And we've had talks with people like Garrison Bliss at Q Alliance, and Dr. Bliss said, "What kind of format does the data come in?" I said, "What do you mean?" And he said, "Well, how do I get the data?" I said, "I don't know. We could send you a spreadsheet with the procedure codes and the prices." And I said, "Why?" And he said, "Oh my God," he said, "this needs to be baked into my EMR. There's no reason any physician in any one of my Q Alliance practice should ever be referring elsewhere to these people, regardless of what the arrangement is." And so, yeah, we've had talks with some of those DPC clinics that get it, and that's what they want to do.
Might even be able to add the report into the interaction to minimize data traffic. And they go there, get it, sends the report back to me.
Yeah.
That'd be pretty cool.
We'll spend a lot of time thinking about what direct primary care does on this.
This is an incredible app.
Oh, well, thank you. And some of the direct primary care guys in here probably know Dave Chase. You guys know Dave Chase? And so, Dave built his Avado platform, which was essentially the patient portal built with direct primary care in mind. He sold that to WebMD. That's now going to be ingrained into a WebMD app, and WebMD and Dave is who we're talking about, further integrating the shopping experience from scheduling and intake to exit interviews. Like we talked about earlier, every time something happens, we want people to say, "Would you recommend this place to a friend?" And so, certainly with Dave's background, I think you'll see further DPC integration in it.
Jim, this is revolutionary. This is so cool. My
Thank
compliments.
you. That
I'm
means
just
the world
glad
to me.
that I'm glad I can change my prices on the fly. That's all I'm going to say.
Yeah, I know.
You want to mention the difference between claims and invoices also?
Oh, yeah, and I'm not sure one of the things, and so if everybody here that's in there, because we've heard talk about, coding and CPTs and things like that, one of the remarkable things that I think that Jay and Keith were able to accomplish in doing this was the elimination of claims. Claims is a perfect example of just fat in the system that doesn't add value for people. People go to school to learn how to code, and now with ICD-10, and I mean, these are easy transactions. I mean, the fact that when I walk out of the surgery center of Oklahoma, because that's where I selected, after my rotator cuff surgery, I mean, that's something that can be automated. I mean, we can get that direct to Jay Kempton. It can go electronically to the employer. It's just easy for everybody. And some employers are going to think this is hard, but it's not. I mean, if you have someone in your organization that can buy pencils and pay a bill, then you're going to be able to do this. We just want to make it easy for everybody, with the docs, the employers, and at the end of the day, the patients. We're just lucky we provide enough value to the employers that they'll pay us to fix all this for their patients. Thank you. Doc, good?
Diabetes.
Oh, yeah, good point. So we really view the Zero Card as a marketplace, and anything that someone wants to sell that's a fair price or anything wants to buy, it'll be in there. So we had an employer in rural Oklahoma that owns a bunch of telephone companies, and this is one thing we're real excited about. And they said, well, this is great, but what else should I be looking at? I mean, besides knee scopes and ear tubes and things like that. And so we looked at their data, and they're diabetics, 17 times the national average on their drug spend alone. And he said, how in the world could this be happening? So we looked at it, and Dr. Schwartz, correct me if I'm wrong, this is a smaller self-funded employer, but a number of these people are spending more than $1,000 a month just on medication. Of the 18 people that were identified in that, I think one had seen an endocrinologist in the previous 18 months. I mean, these were individuals that were in rural populations, probably in primary care settings where the doc didn't have the resources or the time to deal with complicated diabetes patients. So we said, well, who on earth is going to sell us diabetes care? Well, we didn't know what it would cost. We didn't know what a bundle would look like for an annualized piece of care. And we found it probably in a pretty unlikely place. And one of those places was Harold Hamm. The Harold Hamm Diabetes Center, and there's one in Oklahoma City and there's one in Tulsa. And they said, oh yeah, we get it. They sent us bundled pricing, risk stratified into 5 different buckets, and the most expensive one for the most complex, complicated person with diabetes, which included, I think, 3 visits with the endocrinologist, podiatrist, ophthalmologist, nutritionist, health coach, and 24 phone calls for a year, was $1,000 for the whole thing. And get this, for a year. For a year. And get this, they said to us, but what do we do if people aren't compliant? Because a lot of times it's not the patient's fault. We probably shouldn't take the whole $1,000. And I said, well, you know what happens at Surgery Center of Oklahoma if they don't do the surgery? And they said, no, what? I said, we pay them $200. They said, yeah, if people fall out of compliance, then just give us the $200 and call it a day. So we couldn't believe it. I mean, it was just a need that an employer didn't know that they had, and a provider hadn't even thought about. I mean, it's KeithsMatch.com to perfection, And the fact that we can take away the obstacles, and the physicians certainly know this to me. If you're an employer and you have people with diabetes, whether they're whether it's a well-managed condition for that person or not, I mean, who does it benefit putting a copay in front of that person? I mean, that's, proper, condition management is insulation. I mean, if you want your heating bill to go down, your insulation bill is going to have to go up. So once you remove these obstacles and it's free for these people in this health plan to go to these diabetes centers And by the way, you don't have to make 5 visits anymore. You just do it all at one time. We think dipping our toe into that disease state will be a big thing for the market, and we just want to be the place where people go to find value. Thanks for reminding me, Don.